Bipolar disorder, also called maniac depressive disorder, is characterized by drastic mood swings in which an affected individual experiences periods of elevated or irritable emotions alternating with periods of depression. Despite popular belief, bipolar disorder affects men and women equally. It affects approximately 5.7 million adult Americans, or about 2.6% of the U.S. population age 18 and older every year. According to statistics from a study conducted by the World Health Organization, bipolar disorder is the sixth leading cause of disability in the world. The average age for the onset of bipolar disorder is between 15 and 25 years, and although the cause of the disorder is not completely certain, researchers have been able to trace the disorder through generations of family members, therefore indicating that bipolar disorder may be inherited. There are three types of the disorder: type 1, type 2, and cyclothymia. A person is diagnosed with bipolar disorder type 1 when he or she has experienced at least one full episode of mania and many other periods of depression. Bipolar disorder type 2 is characterized by alternating periods of hypomania, which is a less extreme case of mania, and depression. Finally, cyclothymia is characterized by less severe mood swings and is the mildest case of bipolar disorder which with an individual can be diagnosed. Typically, there is no clear cause of bipolar disorder, but there are many possible stimuli that could induce a manic episode in a person who is prevalent to the disorder. Some of these possible stimuli are life changes such as childbirth, periods of sleeplessness, recreational drug use, or medications such as antidepressants or steroids. There are also some physiological causes that can contribute to an onset of a period of depression or an episode of mania. Through recent research, scientists have been investigating the significance of physical changes in the brain of a person with bipolar disorder to determine if there is a biological difference in the brain of a bipolar person compared to an unaffected brain. It has also been found that an imbalance in neurotransmitters, which are chemicals in the brain, and hormones may cause bipolar disorder as well. A person's environment may affect the individual's susceptibility, especially if the person has to deal with stress, abuse, or a significant loss. Finally, although the genetic component of bipolar disorder is still being researched in the scientific community today, researchers at the University of California, San Diego have identified a mutation in the gene protein GRK3 that occurs in a portion of the gene called the promoter that regulates when the gene is turned on. The research team has collected data supporting the idea that this mutation causes the individual to become hypersensitive to dopamine, leading to the mood extremes that characterize bipolar disorder. Although the data on the study has not been solidified in the scientific community, there are many experimental investigations of the same nature that are being conducted in search of the true cause of bipolar disorder. The signs and symptoms of bipolar disorder vary depending on whether the affected individual is experiencing a period of depression or a manic episode. The signs and symptoms of a period of depression are the following: sadness, hopelessness, suicidal thoughts or behavior, anxiety, guilt, sleep problems, low appetite or increased appetite, fatigue, loss of interest in daily activities, problems concentrating, irritability, chronic pain without a known cause, frequent absences from work or school, or poor performance at work or school. The signs and symptoms of a period of mania are the following: euphoria, extreme optimism, inflated self-esteem, poor judgment, rapid speech, racing thoughts, aggressive behavior, agitation or irritation, increased physical activity, risky behavior, spending sprees or unwise financial choices, increased drive to perform or achieve goals, increased sex drive, decreased need for sleep, inability to concentrate, carelessness or dangerous use of drugs or alcohol, or delusions or a break from reality. It is also common for people suffering from bipolar disorder to experience extreme moods that change with the seasons. In this case, people often become manic or hypomanic during the spring and summer and then depressed in the fall and winter. Sometimes patients with bipolar disorder experience rapid cycling of moods, sometimes having around 4 mood swings per year, or even as often as having changes in moods every 2 hours. Finally, psychosis, which is a detachment from reality, may occur in patients, causing the individual to experience delusions and hallucinations. To determine if an individual is suffering from bipolar disorder, the doctor typically performs a number of testing exams. These typically include a physical exam, lab tests, a psychological evaluation, and mood charting. The physical exam involves checking the person's vital signs such as heart rate, temperature, and blood pressure, listening to his or her heart and lungs, and an examination of his or her abdomen. The lab tests might include blood tests or urine tests, which could identify physical problems that might be causing the patient's symptoms. During the psychological examination, the doctor talks with the patient about his or her feelings and behavioral patterns. Finally, after the initial consultation with the doctor, the physician may ask the patient to record his or her moods and sleep patterns. To be officially diagnosed with bipolar disorder, the patient has to meet the criteria in the Diagnostic and Statistical Manual of Mental Disorders. Based on the severity of the signs and symptoms, the patient will be diagnosed with either type 1 or type 2 bipolar disorder or cyclothymic disorder. Bipolar disorder involves a lifelong treatment with a psychiatrist even during periods when the patient is feeling better. The main treatments for the disorder include medications and psychological counseling. Typically, an initial treatment involves taking medications to balance the individual's moods, but if the patient is behaving in a manner that could potentially hurt themselves or others, hospitalization may be necessary. After the initial treatment, it is common for treatment to continue over a long period of time to manage bipolar disorder for the rest of a patient's life. Sometimes substance abuse treatment is necessary if the patient has problems with alcohol or drugs, because it is very difficult to treat bipolar disorder if the patient is under the influence of such substances. The medications that are typically prescribed to a patient with bipolar disorder are lithium, anticonvulsants, antidepressants, antipsychotics, Symbyax, or benzodiazepines. Lithium is used for stabilizing mood swings, but sometimes causes thyroid and kidney problems, so frequent blood tests are required for patients who are taking lithium. Anticonvulsants also stabilize the patient's mood, including Depakine, Depakote, Lamictal, and Safras. Antidepressants are typically prescribed to a patient if he or she is suffering from severe depression, but some antidepressants may cause a manic episode, so it is common for a patient to take an antidepressant along with the mood stabilizer. Antipsychotics such as Zyprexa, Risperdal, and Seroquel serve the same function as anticonvulsants. Symbyax combines the antidepressant fluoxetine and the antipsychotic olanzapine as it functions as a depression treatment and mood stabilizer. Benzodiazepines are anti-anxiety medications such as Klonopin and Valium that relieve anxiety on a short-term basis. Psychotherapy is a crucial part of bipolar treatment, and there are 3 types of therapy that are recommended for bipolar individuals. Cognitive behavioral therapy helps patients recognize unhealthy negative beliefs and behaviors and replace them with positive healthy ones. Family therapy involves the patient and the patient's family members, which is beneficial because it helps reduce stress within a family by helping everyone learn how to better communicate and resolve problems. Electroconvulsive therapy is typically recommended for patients who haven't seen improvements in their condition despite other therapy treatments. ECT involves sending electrical currents through the patient's brain, which causes specific changes in brain chemistry, which leads to an improvement in the patient's mood. This type of therapy is effective, especially for pregnant women who are unable to take regular medications. Since bipolar disorder typically requires lifelong treatment, patients usually have to deal with the disorder for their entire lives. Although it is curable, the cures are temporary, and a patient's condition may be maintained over an extended amount of time. Most patients average about 8 to 10 manic or depressive episodes over a lifetime. Studies have shown that bipolar individuals usually have higher death rates from suicide and heart problems, but patients who undergo continued treatment experience great improvement in survival rates.